Okay, you guys, so today we're answering a question from someone in the comments. We have Victoria who submitted a comment regarding her blood pressure. First of all, Victoria, thank you so much for your question. I know it's not a good feeling when you feel like you're being proactive with your healthcare and it's still not controlled and you feel like you're not getting answers. But I want you to be very proud of yourself that you're being proactive with your healthcare. So I am not Victoria's provider. I do not know Victoria's history. So in this video, I'm just going to provide information on what I've done with patients who have presented like this to me in the past. So Victoria says that her blood pressure is 170 over 102. She's currently being treated with lisinopril and amlodipine, and that she's also had an issue with nosebleeds. So like I said, Victoria, I can't tell you what to do specifically in your situation, but I'll put some things out there, and then we're going to pray that you find a provider who can give you the answers you need and provide the care that you need. So first and foremost, when I have patients who come into the clinic with symptoms like this, you're going to be with me for a while. So I tell them to just go ahead and get comfortable, because you cannot leave the clinic with a blood pressure 170 over 102 or 180 over 120. For anything over 170 and over, I keep patients in the clinic until we can bring it down. So in clinics, we usually have medication, a variety of medication. Usually it's about 20 to 50 different kinds of medication. And we usually have several different blood pressure medications. I usually ask the patient if they've taken their medication that day. If they haven't taken their medication for that day, we'll find the medication that they take and give them the medication. Take their blood pressure every 30 minutes until the top number comes down to closer to around at no more than the 150. So while we're waiting for that blood pressure to come down, I'm coming in and out of their room in between other patients and asking questions. Usually during that time, I'm able to get a lot of information about their history, family history, diagnostic tests that they've had, all the details that's needed to conquer something like this. So number one, you're in the clinic, you're staying in the clinic for 1 to 2 hours until your blood pressure is controlled. Whenever your top number of your blood pressure is 180 or greater, you're literally at risk for having a heart attack or stroke at any minute, because that is a hypertensive emergency. The body can't handle that blood pressure. Now, the body is amazing and it's resilient, because many people live with that blood pressure for years. Their blood pressure will be 200s over 100s. They live with it for years. But the danger is once the body can't take anymore, it will literally stop. So those are the situations where the family will say, you know, my loved one was fine, they went to work just fine, and we just found them down, or they collapsed at work and they don't understand why. And 9 times out of 10, it's because they've had their blood pressure uncontrolled for 10, 20, 30 years, and then they're found down. I worked in ICU. I saw it happen time and again, and it's the saddest thing ever. So that's what we're trying to prevent. So that's why I tell patients like Victoria, thank you for being proactive in your healthcare. It doesn't feel good when it's happening, but once you figure it out and get it conquered, you're going to feel amazing. So number one, you're staying in the clinic. We're getting that blood pressure under control. Number two, we have to look at the medication treatment plan. In the medical community, we have guidelines for blood pressure. The guidelines that we look at is called JNC, stands for Joint National Committee 8. The JNC 8, as you can see, it divides patients up by age brackets, so whether or not they're Black, and kidney function. If a patient is less than 60 years old, the initial therapy should be a thiazide. If a patient's over 60 years old, the initial therapy medication should be a thiazide. If the patient is Black or non-Black, the initial medication should be a thiazide. If the patient has a problem with their kidneys, the initial medication should be an ACE or an ARB alone or in combination with another class, which means we would still give a thiazide. So I'm always surprised when I get new patients in who have uncontrolled blood pressure and they're not on a thiazide. So thiazide would be the hydrochlorothiazide, the HZTZ medication, hydrochlorothiazide. All patients, unless there's some sort of contraindication should be started on a thiazide medication per the guideline. I've had patients who had extremely uncontrolled blood pressure. I'm talking 200s over 100s. They were on 4 different types of medications. And when I added that thiazide in and then they made other changes in their lifestyle, they were able to come down to just 2 medications. Why is the thiazide so important? The thiazide medication helps the kidney. Why is that important? When someone has uncontrolled blood pressure for many years, what is the organ that's affected the worst? The kidneys. Why? Because the kidney has all of these microvascular blood vessels, capillaries, that are responsible for filtering the blood throughout the body. And what happens when you have high blood pressure, that blood pressure is pounding for many, many years. What's going to be affected first? Those small blood vessels. Also, a lot of people who have high blood pressure also have an issue with diabetes. What happens when you have diabetes? All of these conditions affect from the microvascular to the macrovascular. So that means that it affects the small blood vessels and starts killing everything until it gets to the larger blood vessels. So that also happens when you have diabetes. And where are millions and millions of these small blood vessels found? In the kidneys, because the kidneys is responsible for filtering all the blood, and we have to do that through small blood vessels. So I say all that to say that's why it's important to have a medication that has shown to be most effective for helping the kidneys to function better. In addition, where does the hormone that controls blood pressure come from? Aldosterone and angiotensin that regulates our blood pressure. It comes from the adrenal gland, which sits atop the kidney. So all of these factors are very important on why every patient should have some type of thiazide. This is not just my opinion, it's per the JNC guidelines. So for patients who I have who come in who don't have any type of thiazide medication and their blood pressure is still uncontrolled, we're immediately adding a thiazide. In addition to that, we need to make sure that the medication is working. So people only come into the doctor's office at the most maybe once a month, right? So that means the patient has to do their homework. So that means that they have to have a blood pressure machine that either has a memory or they have to keep a log. I usually tell patients to buy one of those little notebooks and just write the date, blood pressure, and put AM or PM. They can bring that in, and the provider looks at it and see if the blood pressure is well controlled. We can say, oh, you know, when they wake up in the morning, the blood pressure is higher, or before they go to sleep, the blood pressure is higher. Then they can adjust the timing of the medications based on those readings. So blood pressure machine, taking the blood pressure twice a day, usually in the morning before you have much activity. I usually tell patients to put it right next to their bed so they can take it as soon as they wake up in the morning or when they've just walked around with minimal activity and before they go to sleep. But when you have activity, you have to wait at least 15 minutes before you take the blood pressure. So you've been in the clinic, we've got your blood pressure under control, now you're going home. I'm making changes. For the patients, I make changes to their blood pressure medication. We want to make sure that it's working, so you're taking your blood pressure readings twice a day. And then thirdly, we have to look at your lifestyle. So many patients that I have don't realize that the medication can't do it on its own. I tell my patients that they have to make lifestyle changes. So first and foremost, smoking is the number one thing that patients can do to help with their blood pressure. So number one, if the person is an active smoker, we're going to find a way for them to stop smoking. That's the number one thing you can do to save your own life. When patients who stop smoking, I tell them you're literally saving your own life by stopping smoking, because what smoking does is it causes vasoconstriction. So all of your blood vessels is actually making them more and more narrow until eventually they die off. I could just do a whole teaching on smoking. So just for now, we're going to stick with smoking cessation is the number one lifestyle change to help keep your blood pressure under control. Then, of course, diet. So I introduce patients to a heart healthy diet. And most of the time, I tell people to do one change at a time. The number one thing that patients can do to help themselves with a heart healthy diet, number one is fast food. So diet, the number one thing that patients can do is to stop any fast food. A lot of patients say they have a busy lifestyle, they can't bring their lunch with them to work every day, and so I usually give them some more nutritional options for fast food. Things like maybe Chick-fil-A grilled chicken nuggets and a salad instead of getting the fries. But stopping fast foods is number one, and then incorporating some type of fiber. So I usually encourage patients to incorporate some type of oatmeal, because what oatmeal does is helps suck up all those bad things, especially the fat. Sucks it up and we poop it out. Number four would be the diagnostic exams, screenings that we can have for patients. The first one, especially for a patient who comes in with uncontrolled headaches or nosebleeds, the long-term exam that we will look at first would be the MRI and MRA. So I think most people know what an MRI is. The MRA is an addition to the MRI, and that's when they put a dye into your body and it highlights all of the blood vessels in the brain. And the radiologist can read the test and see where the person may have weakened blood that will put them at greater risk to have a stroke in the future. And so I have sent patients for this test, and I have had a couple of patients where they found those clusters. They're called AVMs. They put you at risk for stroke, and they've had what's called an AVM clipping. Another test that I order for most patients, especially when they're around 50, but depending on their risk, I may order it as early as 35. We order a test that's called the CAC. It's coronary artery calcium score test. And so that's when a person goes in and has a CT scan of their chest. They get a dye, but the radiologist can see all of the blood vessels and tell if a certain area is weakened or if it has clots, and the person can be referred. So in the past, the only way we had to look at the heart years ago was to go in and actually look at the heart. So the person had to have an entire operative procedure in order for the doctor to go in and see if the person has any blockages. Thank God this CAC was developed, the coronary arteries calcium score, so that non-invasively we can look and see if the person is at risk. And so if the person's score is 400 or greater, then they would be at greater risk and the cardiologist would get involved. Most of the patients who I send for this test, thank God, they come back with their score as 0. But I have had several where they had to have cardiac intervention, and this procedure actually saved their life, because otherwise they didn't have any symptoms, but they were at risk for a heart attack. And both of the people who I'm thinking of, they both had a long history of smoking. So they were a 30-pack year or greater smoker. But they had absolutely no symptoms. They were going to work every day just fine. But this test was able to see the areas in the heart that were at risk, and then they went in and they had stent placement. So pretty much saving their lives through a simple non-invasive procedure. Just to recap, 1, in the clinic, we're going to get a patient who has elevated blood pressure, get it controlled in the clinic. 2, we're going to start medication according to the JNC guidelines, which means that person would be on a thiazide medication in addition to anything else we want to order. 3, the patient would make lifestyle changes. Number 1, smoking cessation, and then we'll look at any areas of the diet that need to be changed. And 4, we will look at those long-term exams. I hope this information helps you. I'm going to also send you the references I was speaking of about what would be the guidelines for blood pressure control. I have it as references underneath this video, but I'll send you the specific screenshot so that you'll have it whenever you go into your doctor's office to make sure they have the information and possibly changing your medication if needed. So that way, if you have a provider who's hesitant to order what's needed and may brush it off and say that's not necessary, you can show them, here are the actual guidelines and this is what I need. Okay, I hope this information helps. I have references for everything that we spoke about in the description of the video. And thank you again for your question, Victoria. I know that the question that you asked helps you, but it also can help many others because many people face this problem every day. Thank you. I hope y'all have a great day.